Welcome to the Protecting Your Nest podcast. I continue to remind you with each episode that protecting your nest requires a focus not just on what and when you eat, but other aspects of your life as well. What you put in your body, removing toxins from your body, and the environment you expose your body to are all important to impact your overall health. So today, I want us to focus on the P in the ROPE acronym. And the P is for pollutants. And pollutants can be the root causes of many illnesses. So many people are trying to avoid them so they won't suffer from the negative consequences. When we breathe in dirty air, we bring in air pollutants deep into our lungs, so it should not surprise you that air pollution causes serious damage to the respiratory tract. Air pollution exposure can trigger many new cases of asthma, could exacerbate or worsen previously existing respiratory illnesses, and of course, provoke the development or progression of chronic illnesses, including lung cancer and chronic obstructive pulmonary disease. Air pollutants also negatively and significantly harm lung development in our babies, creating an additional risk factor for developing lung diseases later in life. In order to ensure we better understand environmental pollutants, I have asked a good friend. In fact, this good friend works right down the hall from me. And more importantly, he's an expert in the field of allergy and immunology to join us to shed a little much needed light on this topic. Today's guest is Dr. Michael Fox. Dr. Fox is the Chief of Allergy and Immunology at Advocate Aurora Health. He is a well-respected doc and who has extensive experience in the treatment of allergy and non-allergic sinus disorders. He has served in the prestigious roles of both the American College of Allergy, Asthma, and Immunology president and the president of the American Association of Certified Allergies and Immunologists. He is a distinguished fellow of the American College of Allergy and Asthma and Immunology, and a fellow of the American College of Chest Physicians as well as a fellow of the American Academy of Allergy, Asthma, and Immunology. So he has a lot of letters behind his name. He is a member of the Medicare Evidence Development and Coverage Advisory Committee of the U.S. Department of Health and Human Services and past member of the U.S. Food and Drug Administration Pulmonary Allergy Drugs Advisory Committee and recipient of the FDA's Distinguished Service Award. Dr. Fox is a living legend in medicine award recipient from the Dr. Joseph Henry Tyler Jr. chapter of the National Medical Association in 2019 and the recipient of the Distinguished Service Award from the National Medical Association in 2019 as well. He is a graduate of Harvard Medical School and Yale University, and he's also, again, my friend and colleague. And with that, Dr. Fogg, it is my pleasure to welcome you to Protecting Your Nest. How are you doing today?
Fine. It's my pleasure to be here, Dr. Hampton.
Absolutely. It's my pleasure. I didn't have to look far to find you. And sometimes I find the experts right down the hallway, and I've been working with you for a while, and it's just a pleasure to finally get you on. And when I thought about the topic, what do we do about that P in my ROPE acronym? How do we talk about pollutants? And it was an obvious decision to ask you to join me. So I really appreciate that. And I want to start our conversation, by going backwards a little bit. And I remember when I was in medical school, there were a lot of students, talking about going into various fields. You would always hear surgery and internal medicine and family practice and a little derm and a few other things. But it was rare that you would hear someone talking about going into allergies. So why don't you tell us a little bit about why you chose to be an expert in the field of allergy?
I'm happy to. When I was at Yale University as an undergrad, I did research in an immunology laboratory, and my proctor was head of the microbiology immunology division at Yale University School of Medicine. And so as a result of doing bench research as a freshman, sophomore, junior, and senior student at Yale University undergraduate, even though my research was at the medical school, I had to make a decision as to whether or not I wanted to become a bench immunologist or whether I wanted to apply the knowledge attained from doing bench research and its clinical application to real life patients. And so I decided I didn't want to work with rats for the rest of my life, even though a lot of valuable research comes from working with rodents and other animals. And I wanted to be at the transitional stage of applying new knowledge at a clinical level to improve the quality of patients' lives. And so if you decide to go that route, the only specialty that exists for that purpose is the specialty of allergy and immunology.
All right, that's interesting, and I think about that's a lot of foundation, research, and even when you think about the elite schools that you've been privileged to attend, that's really giving you a lot of experience. And then when you look at, all the things I mentioned in your intro, I mean, president of the College of Allergy, that's like going 30,000 feet in the air and really looking at the world through a different lens, a lens that even your allergist colleagues may not be able to see. And then working with our government to, talk about, policy and things like that. So I'm just curious, like, so when you think about how all of those experiences has impacted you in terms of how you practice the art of medicine, what would you say has been the benefit of having that vast array of experience?
Well, you get to see how medicine can be helpful in people's lives at a variety of levels. The research is extremely important. And so my hat's off to those who decided to continue to do bench research. You and I both do some degree of clinical research, but bench research is a different ballgame. And sometimes you're isolated from your colleagues, and it's just you and the animals. And you're thinking about pathways and mechanisms. And even though that work is extremely important, uh, I decided that I was best adapted to working with patients. And when you work with patients in this specialty, there has been a historical tendency for most allergists to take care of upper middle class, highly affluent individuals because those are the people who can afford to see an allergist until recent changes in our healthcare policies. And so, to that extent, allergy and immunology for decades was not available in the inner city, not certainly what is referred to as the ghetto. And so, as a result, many of our people were deprived of the expertise that is available for addressing allergic disorders and immunological disorders. And so I decided that not only did I want to work with real life humans, but I wanted to work with minorities primarily because I wanted to bring my expertise to apply to their clinical problems so that their quality of lives could improve individually and collectively. And so we now all talk about population health and precision medicine. Well, population health requires somebody who is available to apply expertise for the population at large, and at the same time providing precision medicine for the people who are under our care, giving them the right treatment for the right diagnosis at the right time for the right duration. And so that's one of the privileges that I've had in being able to serve our community because there are only approximately 200 black allergists in the entire country, and there are only 4,000 allergists in America that are practicing, and the rest have retired. And so it's a relatively small specialty. We have 250 black neurosurgeons, and so the number of black allergists is actually less than the number of black neurosurgeons. And part of that is because it's exceedingly difficult to get into some of these training programs, which are the postdoctoral fellowships in allergy and immunology. Competition is exceedingly stiff, coupled with the fact that a lot of our doctors, when they're in their residency internship, are not attracted to allergy and immunology largely because they haven't been exposed to somebody who's an allergist immunologist. And we're
Mhm.
trying to address that problem within the National Medical Association by reaching out to high school students as well as to medical students early in their careers to let them know that there's another specialty. You hear about allergy all the time. There's no shortage of articles about allergy. Allergy is integrated into movies and TV shows, but it's hard to get African Americans into programs that allow them to become allergists and immunologists. And hopefully that will change as time evolves.
Yeah, my mouth is on the verge of dropping, hearing a statistic like 200 in a country of 360 or so million, to only have 200 and even 4,000 to serve our entire population in a world filled with allergies, filled with asthma, filled with COPD, filled with all of these conditions.
And the paradox, Dr. Hampton, is that over the past several decades, there's been an escalation in the frequency of allergic disorders, autoimmune disorders, respiratory disorders, and the numbers of individuals who are trained to address these problems with the worldwide escalation. So it's not just in one country. Those numbers have not increased significantly. And so that's why there's a sometimes 3 to 4 month booking distance between the time one makes an appointment to see an allergist and the time that they can actually have that appointment in the absence of a life-threatening emergency.
Absolutely. And I do have patients who sometimes are asking me, do I know a person in your specialty and others who are of color? Maybe they're just more comfortable. And I do have your same passion in that I serve all my patients, and there is a variety of patient types. But I was attracted to our clinical site where we work because I knew that there would be a lot of people from the community I grew up in, and it's nice to know that an expert like yourself, with your resume, is able to serve a community where the need is great. And one of the things I also believe in is just teaching wellness and health to communities that need it the most. And I know my voice will reach all communities, but it's nice to know. And that's what I'm doing with the Society of Metabolic Health Practitioners and the Outreach Committee, is to teach metabolic health and wellness to the communities that never hear that message. So I really appreciate that. And I do want to, ask my next thought, which speaks to how I approach healthcare in general. And I really believe that if we don't fully understand the root causes of why we get sick, we will struggle to be healthy. And in my current training in functional medicine, I've learned that getting a good history is key, and understanding if, a kid, for example, has suffered from infantile eczema, that may then proceed to allergic rhinitis and progress to allergic asthma. This may have been caused in some cases by allergies to certain foods or other environmental allergens. So, when I think about how I'm being trained to approach patients, I'm curious how you approach patients so that you can identify and understand what the root causes or maybe even the triggers are to why they're sick with allergies or asthma.
Well, when it comes to asthma, the cause of asthma is unknown after being studied for well over 100 years. And what we call asthma now is probably a collection of inflammatory airways diseases, which we will rename as more research delineates the mechanism by which those diseases surface. So, asthma is really a collective group of heterogeneous respiratory disorders that have sufficiently similar features to be referred to as asthma. Those features being chest tightness, coughing, shortness of breath, and wheezing. If you have those four symptoms, you may not necessarily have asthma, but the first diagnosis that is going to be considered, regardless of your age, is asthma. Asthma is a condition that we think is preventable, getting back to your point of exposures that predispose to injury to the airways. So when it comes to viruses, we know that some viruses can permanently damage the airways. For instance, a virus called respiratory syncytial virus is a virus that results in permanent airways damage, so that some 15% of individuals who are children who contract respiratory syncytial viral infections go on to develop asthma. Now, that doesn't mean that that's the cause for asthma, but that's certainly a cofactor facilitating the endpoint expression of the disease that we call asthma, which is characterized by airflow limitation due to the bronchoconstriction of the airways, which causes the wheezing, which causes the shortness of breath, which causes the chest tightness, and which causes, due to mucus buildup as well, the coughing. And so an ounce of prevention is worth a pound of cure, an old adage. And to that extent, if we can eliminate smoking within households, eliminate maternal smoking, eliminate biomass fuels and wood stoves in households that emit noxious and toxic agents, lower the level of indoor air pollutants from other sources such as volatile organic compounds, hairsprays, deodorizers, insecticides, perfumes, colognes. Deodorizers are particularly troublesome because you're trying to get rid of the smell, but at the same time, you're loading the room with volatile organic compounds, which are being inhaled not only into the lungs, but into the nose, and they reach the sinuses, and they can wreak havoc based upon one's predisposition towards having an exaggerated response. So none of these chemicals are beneficial or healthy for anyone, but
Mm.
there's a certain subset of individuals that has a proclivity towards experiencing an exaggerated response when the insult transpires. And sometimes this is overtly manifested. Other times it's so subtle you would not even think that it was a problem. But as you mentioned, collectively over the years, it's been determined that exposure to these kinds of things, in addition to environmental tobacco smoke, results in absorption of these agents into the airways of growing children, which can result in impairment of growth, natural, normal growth of lung function. And the endpoint of this may not be manifested until they're well within the adult years. What has been done is the collection of pulmonary function over time. Normally, pulmonary function, where you blow into a specialized device to measure lung function, is an isolated event, and you may get it done once in your life, or maybe every 1 or 2 years, or 3 years, or 5 years, based upon what the situation is. But what's been determined by Dr. Stan Zeffler, University of Colorado, is that if you do serial pulmonary function tests in growing children, you can see trajectory patterns, which will give you a clue as to whether that child is going to have normal lung function when he or she reaches adulthood, or whether that child is going to have impaired lung function with premature decline of lung function after adulthood has been reached. This is critically important because we now know that air pollution, especially indoor pollutants, have a direct impact on inhibiting normal lung growth in growing children and setting them up for premature decline in lung function for either asthma or COPD, or both in the form of asthma COPD overlap. At one point in time, it was taught that COPD was caused exclusively by cigarette smoking. But we now know that only 85% of people who develop COPD are smokers or even have exposure to smoke. So something else clearly has been going on, which has been resulting in deterioration of lung function over time, resulting in chronic obstructive pulmonary disease, which can be a devastating disease and associated with a very poor quality of life. We also know for the first time that asthma can evolve into COPD, and that a
Mm.
person can have asthma and COPD at the same time. One can precede the other. Asthma can precede COPD, or COPD can precede asthma. But the interesting thing that was surprising to many was that a person who had childhood asthma, especially if there were a late diagnosis, which occurs commonly in urban America, especially among minority populations such as Blacks and Puerto Ricans, if that diagnosis is late, then you can have permanent damage done to the airways. And what started off as asthma has now turned into COPD, which can be a much worse condition with a much worse prognosis.
You're sharing some really interesting nuggets. And as a family practice trained clinician, I particularly noticed this RSV, uh, even though that's not a pollutant in the traditional sense. I remember in my family practice training, it seems like all the kids had gotten exposed to it by the age of 2. So to imagine that that many kids are exposed to that, and then there's a percentage of them who end up, having some long-term negative effect is definitely something I think any parent listening would be nervous about. And I think it's really important. That's why I really try to share with my patients, as you take care of yourself and your family, let's create a body that's not really a good place for diseases to flourish. And I think the healthier we are, the better we're able to kind of recover and maybe not necessarily have, any bad things happen like oxidative stress where there's inflammation. Let's just have a strong body. So I really think about that as you share your points. But again, I think as people are thinking about how they protect themselves, it's really about just understanding just enough to do the things necessary to make sure your family's safe. So, another thing I've learned in my functional medicine training is how important your gut is. And I had not heard much about leaky gut until I took additional training. And in that training, that's something that some of the people I'm learning from says could be connected to allergic disease. So, and they recommend things like elimination diet, so you can figure out which foods irritate your gut and maybe replace those foods with things that heal the gut. So, I guess my question is, since your training was more traditional as well, was there any discussion about leaky gut in your training in allergy or in your current understanding of any connection between a leaky gut and allergies?
The answer is during my training, no, that was not considered to be a concept that was adopted and embraced as being contributory to allergic disorders. However, subsequent research has determined that the gut serves as a barrier, just like the skin serves as a barrier. So you mentioned earlier children with eczema going on to develop allergic rhinitis, allergic asthma, and that's because the barrier of the skin, in some cases due to a genetic deficiency, is associated with entry of agents through the skin, which now sensitize the immune cells in the body, so that now that sets you up for what's called the atopic march, whereby the immune system is so modulated by this exposure that it adapts, and the adaptation results in development of not only eczema, which started the process in most cases, but allergic rhinitis, sometimes severe allergic rhinitis, sometimes referred to as hay fever, even though it's not related to hay and there's no temperature elevation. That's a term that some people relate to allergy. And also asthma. And it's usually allergic asthma. And 90% of children who have asthma have allergic asthma. 80% of adults who have asthma have allergic asthma. So all asthma is not allergic, but most asthma is allergic. And if you have the same kind of barrier disruption in the gut, likewise, there's certain agents which would have no access to other organ systems and to the immune system because of the barrier that has been set up in the gut naturally in order to inhibit the absorption. And when the gut is leaky for whatever reason, and there are different theories to suggest as to why, but for whatever reason, the leaky gut now allows what we call antigens to penetrate the gut and to stimulate immune cells in a way which results in not only heightened exposure to the agents in question, but an immune response, which results in allergic hypersensitivity. And I know that you're very much into nutrition. And one of the things I like to mention, which is critically important as it relates to allergic disorders and asthma, even though we don't fully understand what the significance is or what the mechanism is by which it's important, is vitamin D. We know for a fact that individuals who have low vitamin D levels are going to have a heightened expression of asthma in most cases, more frequent asthma exacerbations, and more likely decline in lung function over time until that vitamin D level is normalized. We also know that allergic reactions can be heightened in expression, especially to foods, if you have vitamin D insufficiency or vitamin D deficiency. And what I like to point out is that if you go to Central Africa, the average vitamin D level of residents in Central Africa is 75 nanograms per ml. The average vitamin D level of African Americans in the United States is 25 to 30 nanograms per ml. So the majority of African Americans walking around in America have low vitamin D levels, and those low vitamin D levels are contributory to suboptimal health in a variety of ways. We're just focusing now on allergy and asthma. I once saw a 7-year-old boy whose vitamin D level was checked by me because he had severe asthma, which was not responding to standard therapeutic interventions. Turns out he had an undetectable vitamin D level. And so the reason his vitamin D level was undetectable is because his school ran out of money and canceled research, so he couldn't go out and play. He lived in a very bad neighborhood where there was drive-by shootings, so his mother wouldn't let him go out to play. And when he would visit his grandmother on the weekends, because she lived in a different bad neighborhood with drive-by shootings, she wouldn't let him go out to play. So here's a child from the time he awakened in the morning and went to school, never got any sunlight, and his vitamin D level was literally undetectable. I can't tell you what he was set up for in terms of developing diseases as a result of going years if that hadn't been undetected. And let's say they finally discovered his vitamin D level was low at age 35. Who knows what diseases he would have been set up for? And the last thing I like to say about vitamin D is that vitamin D is the only vitamin that is not simply a nutrient. It is a hormone and it's an immunomodulator. And what I tell patients about hormones is that hormones are chemical moieties that are required for normal regulation of every organ system. So if you have a low level of a hormone, sooner or later, one or more organ systems will begin to dysfunction. In the case of vitamin D, one of the areas of dysfunction is that you lose the immunomodulation that is driven by adequate amounts of vitamin D in the body. And that is due to the fact that vitamin D stimulates the production of natural antimicrobial peptides. So we have natural antibiotics. They're called beta defensins and cathelicidins that are stimulated specifically by vitamin D. And it's been proven that you have a higher prevalence of influenza, other infections such as rhinoviral infections, common cold infections, as well as bacterial infections, setting you up for pneumonia, sinus infections, etc. And most recently, out of the University of Chicago, they've demonstrated that low vitamin D levels increases your risk of contracting COVID-19 virus. So vitamin D is critically important for asthma and allergy, as well as many other things. And I know with your expertise in nutrition, you harp on that. But to date, we haven't had vitamin D levels being accepted as a routine test by many doctors. And I think it really should be. And if you live above the 37th parallel, and where we are in Chicago is well above the 37th parallel, you only get adequate sunlight 2 or 3 months out of the year. And so, since the precursor of vitamin D is in the skin, you activate that by ultraviolet radiation from the sun. And if you stay indoors or cover your body too much, you're going to have a low vitamin D level because vitamin D is not found in significant concentrations in foods except for cold water fish, which you can't eat more than twice a week because of mercury in wild type fish and other chemicals in farm raised fish.
I had the privilege of interviewing president of Advocate South Suburban Hospital and Trinity Hospital in our health system, Rashard Johnson, on 2 episodes of the Protecting Your Nest podcast. And during one of those episodes, I think it was the first one we did, he talked about that how your zip code matters. And I think about Streeterville, which is north in Chicago, versus Inglewood. And the life expectancy he shared was 90 years for Streeterville and only 60 years for Inglewood. So when I think about a zip code, and I think about your comments as it relates to drive-by shootings. And I thought it was the drive-by shootings that was killing us. I had no clue that it was the lack of exposure to sunlight because I can't let my kids go outside and play. It just breaks my heart just thinking about it. And I can't value my babies enough that I can't have a budget that will make them able to go and play outside because we got to cut everything. And what kind of country do we live in when we don't value our babies and we don't value our community? So it breaks my heart. And I really appreciate you sharing that because people who have no understanding of what life is for other people, it provides a little insight, just a little window into why people struggle, why people struggle, maybe why they get sick, maybe why they don't do as well in school. There are factors that are off the radar, off the grid, and we have to bring this to the light. And I really appreciate you having some insight in that area. So, wow. So when it comes to, reducing suffering that comes from disease, we think about, morbidity and maybe the death rates. We want to reduce the death rates, and we call that mortality. These are important things that we all want to do. And because I don't think there's anybody I know that enjoys being sick or and likes the idea of not being here longer for their family. So, as it relates to environmental pollutants, there are probably some steps that people can take to mitigate their risk. And sometimes those steps are indoors, sometimes those steps are outdoors. So, as a general rule, as an expert in the field of allergy, what types of things would you just practically suggest that people consider to kind of cut back on the risk of exposure to toxins and pollutants in the environment?
Well, when it comes to outdoor pollution, in some cases, by virtue of the individual zip code, there is no escape. You live near the expressway where there is the consumption of a lot of gasoline, which is resulting in release of petrochemicals and diesel fuels into the ambient atmosphere, and you live there, so you have nowhere to go. Or there's a big factory that's spewing out toxic agents, including coal, which you live near, and so how can you possibly escape? So, I mean, we're into wearing masks now because of COVID-19. But even if you wore a mask, you would only mitigate the exposures to a limited degree, because unless it's an industrial mask, the standard mask can't keep out these small particulate matters. The Environmental Protection Agency uses terminology PM1, PM2.5, PM10. And the bottom line is that that acronym stands for particulate matter, and 2.5 is less than 2.5 microns,
Mm,
and the 10 accordingly. And so these particular pollutants are airborne 24/7. During the summer months, the concentration may increase, which is why you hear about your ozone action days or ozone alerts. But it's more than just ozone. It's nitric oxide, petrochemicals, diesel fumes, sulfur dioxide, as well as other chemicals coming from factories, which all get released into the air. And on a hot summer day, when the humidity is high, you have a high concentration of air pollutants, due to the fact that the air pollutants are being trapped because of the high humidity and because of the high temperatures. And so some of this relates, of course, to climate change, but um, some of the exposures that we're talking about have been part of the problem long before we started to talk about climate change. And so there's not a whole lot you can do if you live in the inner city.
mm,
If you take a trip to an exotic location, like the Caribbean or the Polynesian Islands where the air is pristine, or upper Alaska, uh, when you return to Chicago, you may have the experience of being able to acutely smell the air.
mm.
Because as you re-enter the environment, you can tell that things are not the same. And sometimes when you fly in, you can see the halo of air pollution hovering over the city. So it's a real thing, and unfortunately, there's not a lot of escape in terms of outdoor air pollution exposure. Indoors, there are things you can do. Certainly, you can consider purchasing an air cleaner, sometimes referred to as an air purifier, and that can be strategically located in problem areas, especially if you are treating the environment to remove allergens from the air. But remember, these indoor air pollutants, ranging from volatile organic compounds, which are small chemical moieties that are released from a variety of household agents, ranging from deodorizers to cleaning agents to hairsprays, as well as releasing into the air from perfumes and colognes. Any cleaning agent contains volatile organic compounds. And whether you can smell these or not, or whether you are noticeably troubled or bothered by these, they're in the air and you're inhaling them. And the question is what to do about it. Well, if you want to invest some money in a very high quality air purification system. That would be a reasonable investment to help protect you. And you can also go to certain vendors who sell cleaning products that are devoid of volatile organic compounds. They're a little bit more pricey, but at least you're not spraying all these elements into the air. And the other thing to be highly mindful of is mold. Now, we normally think of black mold as being a terrible problem because it's the one we hear about in the media all the time. Black mold. Black mold is caused by what's called Stachybotrys mold, and that's the reason that one of our high schools in the greater metropolitan Chicago area some years ago was shut down for an entire year just to clean up things. But if you have any flooding in your home after rainfall, if you have a leak from your pipes, water seeps into your housing, the drywall becomes wet, and next thing you know, you're collecting mold in your home and you can't see it, and frequently you can't smell it. So we see a number of patients who come in saying, I'm allergic to mold. And the take home point is mold allergy does clearly exist. But the majority of people who are getting sick from mold in the household are not even allergic to mold. They are suffering from exposure to a specific toxin called mycotoxins
Mm.
to release from the mold as the mold proliferates. Sometimes you can smell them, sometimes you can't. But if the concentration increases, you can have a variety of subtle symptoms and more overt symptoms. You can have fatigue, sometimes intermittent dizziness or vertigo. You can have disorientation transiently in some cases, as well as the overt symptoms of eye irritation, headaches, shortness of breath, coughing, chest tightness. So there are a lot of things to be concerned about. And the good news is that a high quality air cleaner, either HEPA efficiency particulate air filtration system, so called HEPA, HEPA, plus or minus that device coupled with ionization. So some air purifiers or air cleaners are now available that have both technologies built into the same device.
Excellent. I know we made a video short where we talked a little bit more in detail about clean air machines and how to go about doing that. So, hope for those who are listening or watching, you should be able to find a video, maybe a few weeks after the podcast is released. So, just search my name, Dr. Fogg's name, and you should be able to find that. And I do appreciate some clarity. I think we feel helpless sometimes, but knowing that there are some things we can do is important. And we'll continue to fight for communities that are sometimes, put at a disadvantage because of economics, and they unfortunately suffer because of that. So thank you for those insights. And I do want to ask you a little bit about, we know that current and ex-smokers account for a lot of the patients who end up with COPD. And we know also that exposure to air pollutants may play an important role as well. So I guess my question is, are there any differences between the pollutants that cause COPD versus other conditions? Anything that we should be kind of aware of in that space?
Well, cigarette smoke is certainly bad, so we encourage all of our patients not to smoke, not only because of respiratory conditions that can be precipitated and or aggravated by cigarette smoke, but because of systemic manifestations associated with the 5,000 chemicals that are found in cigarette smoke, none of which are good for you, 50 of which are carcinogenic. So that cigarette smoke is bad, side stream smoke is worse. So if you live in a household where a person smokes, they may go to the bathroom and smoke, but you're getting that smoke, and that smoke is causing damage to your body as well as theirs. Smoke adheres to clothing, so even if you're not inhaling it into your lungs at the time that the person is smoking, it's absorbed into your clothing, into their clothing, and it's really a bad thing because it increases your risk for cancer, a variety of organ dysfunctions, and it's not just lung cancer; it's other cancers as well. And it damages the airways. Inside of the respiratory system are these little tiny fingers called cilia, which sweep mucus. In the case of the nose and sinuses, it sweeps down to remove them from the nose, to remove agents that are contained in the mucus from the nose and the sinuses. In the case of the lungs, they sweep up. Well, when you smoke cigarettes and when you're exposed to some of these other household pollutants, they can actually paralyze these little fingers called cilia. And once the sweeping mechanism is paralyzed, you're now collecting the very thing that was designed to be swept away, which includes allergens, which includes irritants, other pollutants, which includes viruses and bacteria. And that's one of the reasons people are so sick. Poorly ventilated areas are associated with accumulation of the various agents, such as viruses and bacteria, as well as indoor pollutants and also allergens. And so, if there's poor ventilation coupled with the absence of an air cleaning machine, uh, you're just breathing in things that are bad for you day in and day out. And this not only occurs at the home, where at least in most cases you can open the window, but we now have so-called tight building syndrome. In the interest of energy efficiency, most of the buildings throughout the United States, the commercial buildings, are tight. You cannot open the windows. As a result of not being able to open the windows, whatever is contained within the building moves from floor to floor. And there are people who actually have subtle illnesses, and in some cases more overt illnesses, just because they're constantly inhaling particulate matter and viruses and bacteria, which are making them sick. And it's not like a 911 emergency, but they're they are dysfunctional individuals because their energy level is low. They're sort of working in a fog, and they don't know what the problem is. They feel sluggish. They feel fatigued. The doctor checks their thyroid hormone levels. The doctor checks their blood count to make sure they don't have anemia. But the one thing that's exceedingly difficult to check is what the air quality is in their home and at their workplace. And absenteeism is what we talk about in association with these exposures. But the real problem is worse than absenteeism. It's what we call presenteeism. And that is, despite the fact that you have a bad cold, or despite the fact that you're suffering from inhaling the indoor pollutants that are in the workplace, you show up anyway because that's your job and you want to be there. But the fact of the matter is, if someone were attacking that problem for you and attacking and correcting the environment, then you wouldn't suffer from presenteeism just by being there with ongoing illness. The problem would be fixed, and you mysteriously notice your energy level was stepped up, and that you felt more comfortable. You had a better quality of life, less sinus infections, uh, less chest congestion. I mean, it's a real thing. And the other thing that is not pollution that's critically important that we don't talk about a lot is humidity, which is the relative moisture content of the ambient atmosphere. And what we know is that the perfect humidity for the entire human body, not only the respiratory system, but also the skin, is 40 to 50% indoor relative humidity. That is, the water content of the ambient atmosphere is 40 to 50%. Well, we know if you live in a city like Chicago or any other climate that gets cold, the cold temperature occurs with the dumping of moisture out of the air. And so now the fall season has arrived and it's cool, and the moisture has been dumped out of the air, and now it gets colder, and now you turn the artificial heat on, which sucks up the residual moisture that was there. And when we have patients to buy a digital humidity gauge, which costs about $20, and actually measure humidity in their homes during the fall, winter, and spring months, they frequently tell us the humidity is only 10 to 20%. You can't have a normal physiology of your skin and of your respiratory tract with a relative indoor humidity substantially below 40%. The flip side of the coin is if the humidity is too high and you get into the areas of 60, 70% indoor relative humidity, you now can impair cognitive function. You can induce mood swings. And it's also detrimental to your health to have a humidity that's too high. So that's why we encourage people to invest in these $20 to $30 digital humidity gauges that any of the local stores carry. Now you can carry it from room to room and determine, especially in your bedroom, whether the indoor relative humidity is in the ideal range, which by medical definition is 40 to 50%.
That's something I hadn't heard before, and that sounds like a good investment. Something I definitely will look into for my family as well. And as you were talking about how we have to worry about kind of living in a box and not letting air come through, I thought about a recent story that I saw of a family or families in India and how they cook indoors basically with wood, and it's like literally smoke everywhere, and the moms are cooking in this environment, and they simply are just I mean, I think we have issues here, but man, I tell you, in some of these poor countries, it's even worse because they have to cook indoors and there's smoke everywhere, and they're probably using wood. And I just think about how this is really a problem that's throughout the world, and we really got a lot of work to do to keep people from dying at early ages from something that may or may not be preventable depending on resources. I'm sure that the issue in those countries is not having access to electricity to cook with and probably gas, and therefore they have to use an option that's probably less desirable. So just wanted to share that. And I do want to think about what you just talked about. We've talked about allergies, asthma, COPD, and obviously lung cancer is also uh, there's an increased risk because of smoking. And you know, any additional thoughts about, you know, pollutants that can increase your risk for lung cancer? It sounds like they would be similar, but are there any nuances or differences with lung cancer?
Well, we always talk about radon, which is present in some homes based upon radon seeping from the earth into the home. And so it's now recommended that people have annual checks to determine what the radon concentration is. It should be zero. But if the radon concentration is elevated, that's been proven to increase your risk for developing lung cancer, independent of whether you smoke cigarettes. All
That's
of the air pollutants are detrimental to your body. And we have a phenomenon that is relatively new. Normally, we talk about genetics and gene mutations being associated with diseases, but now we have a certain area of medicine called epigenetic medicine. And epigenetic medicine is critically important because it no longer takes a generation to cause illness that can cause death based upon alteration of the genetic material. In the case of genetic mutations, that requires a generation or two because a fresh mutation occurs in many patients, and individuals inherit genetic aberrancies from either parent. But these chemicals that are air pollutants that we're talking about have the ability to latch onto an individual's DNA. And when these chemicals latch onto the DNA, even though the anatomic structure of the DNA has not been altered, the function of the DNA has been changed, which results in a variety of disease states. This area is in its infancy, even though a lot more is understood now than, say, 10 years ago. But epigenetic disease is now considered to be just as important as the original genetic diseases that we talked about. And part of that is directly linked to air pollution, indoor and outdoor air pollution. And so the problem is that um, epigenetic changes are not routinely tested because they're prohibitively expensive and usually part of a research project as part of investigational resources that are available for looking into this. But just keep that in mind. And over a period of years, a newborn born today could have toxic exposures causing epigenetic changes that sets them up for autoimmune disease, cancer, and a host of other conditions.
that's really amazing. You know what's really refreshing is conventionally trained doctor, Yale, Harvard, is speaking the language of what I'm learning in functional medicine. We talked about leaky gut earlier, and I wasn't sure what you would say about that, but it's nice to know that conventionally trained doctors are now thinking about leaky gut. And one of the first lessons I learned in my training was epigenetics and how our environment affects our genes. And like you said, it doesn't take, you know, a whole lot of generations to have an impact. And but it reminds me of our babies and how important they are to us. And I could only imagine that an adult like me and you will be impacted by our environment, and it will affect our genes, which subsequently will affect our babies. But I also assume that they are more vulnerable to the pollution that's in the environment. So when you think about our babies, when you think about our children, and the impact that pollution can have on them? Are there things about them that makes them more susceptible to the negative effects of pollution in our environment?
I would say yes, because they're growing, and an individual who is growing has certain mechanisms and processes taking place in the body responsible for that growth. And that growth is based upon a genetic template, but it's also based upon environmental exposures. It's what we call gene by environmental influences.
Mm,
So that if you have a certain genetic makeup, you may be able to get away with exposures that are of tremendous negative consequence to an individual who has a different genetic makeup. And so we're just getting into the area of being able to identify what we call different genotypes associated with certain phenotypes, which are the clinical manifestations of a medical problem. So that, in answer to your question, for the same reason that obstetricians do not allow pregnant mothers to take certain medications or eat certain foods during the first trimester of pregnancy. Why? Because of growing organs that could be deformed during the growth process as a result of exposure to the noxious and or toxic agents that the obstetrician is concerned about. Take that to another level. Growing children also have things that they really shouldn't be exposed to, not only environmental tobacco smoke, but all these outdoor pollutants we're talking about. And based upon their genetic predisposition, which is variable from individual to individual, some of them will have high risk for developing disease because they are based upon their genetic makeup having an exaggerated response to the same exposure that may not result in an exaggerated response in another growing child because of his or her different genetic makeup. And this falls along ethnic discrepancies in demographics. So, we always talk about what is the significance of race. Well, if you look at the genetic makeup, we're looking at associations now on the basis of empiricism to say if you are a person of a certain ethnic descent, you are more likely to experience condition XYZ. And part of that is because of your genetic makeup, but it also is part of your environmental exposures. And that's why it's called gene by environmental exposures, ultimately determining in many individuals whether they develop a disease. So we don't understand it completely, but the complexity of the situation is further complicated by our not completely understanding the genetic system. We have the human biome and the human genetic template that has been worked out over time, but we still don't know the permutations of exposure that result in a certain endpoint expression of disease for a given individual. And this is why population health is taken off, because we're looking at populations, we're looking at zip codes, we're looking at ethnic background, we're looking at demographics, we're looking at risk factors. And now, if you put all that together, now hopefully you can design instruments to forestall certain diseases, short circuit the development of certain diseases, or at least decrease the expression of those diseases so that people who still have the disease can have a length of life that is commensurate with those individuals without the disease. And that is called precision medicine.
mm, you're blowing my mind because I think about the kids who can't go outside because of drive-bys and they're deficient in vitamin D. I think about the kids who live in safer neighborhoods. And my assumption is that because it's a safer neighborhood, and assuming they're not living on a computer, they can be outdoors and maybe they're still at risk because they're more exposed to the impacts of maybe in the summer there's more ozone and pollutants in the air that they may be exposed to. So it's almost like you have to think about the multitude of various factors.
Yeah. And there's another component. It has been proven that individuals who are victims of violence or even who witness violence, who happen to have asthma, have more frequent asthma attacks and more severe asthma in many cases.
Mm,
And so there's an emotional component that's associated with this. And as we know, emotion is linked to hormonal balance in some
mm,
cases. And so if you're in a tense state 24/7 and have high epinephrine levels that is going to be detrimental to your overall health. You're more likely to have high blood pressure. You're more likely to have a heart attack or a stroke. A variety of influences on your multiple organ systems is impacted by the emotional, intense nature of your exposure to violence, whether you're the victim of it or whether you're a witness of such violence. And that's one of the environmental factors that constitutes one of the social determinants of healthcare. So we've been talking about tangible influences that can be corrected in some cases by interventions, but there are also less tangible influences which constitute the social determinants of healthcare, which determine one's ultimate health. Because if those variables are not attacked, just as the tangible variables are attacked, the health outcome is still poor.
Mm. And again, I'm always reminded of what I'm learning in school. And everything you just said sounds like I'm listening to one of my professors, because it's like the alarm is always going off, and your fight or flight mechanism is just not getting a break. So of course that's going to cause problems. And another thing I learned recently, which was pretty fascinating, is if you if you think something and your body really thinks it's happening, it's going to have the same effect. So if you perceive yourself as being unsafe or under stress, whether it's true or not, your body will manifest metabolically that way. So it's really amazing how, when you're dealing with social determinants of health, it's not just making sure we don't have a food desert or that we have access to care. It's like all of these other components. That's why Advocate has a trauma center at one of our hospitals, and we did have Vicki Smoter, who is the lead clinical psychologist, on one of the previous episodes, and she talked about trauma, because if we don't address these other aspects, it's hard to heal. It's hard to protect your nest if you're not addressing those aspects. So I'm really fascinated by this conversation. I do want to ask an easier question that the average person probably wants to know, and that is, when it comes to our babies, can our babies outgrow asthma and allergies?
That's an interesting question. If you look at epidemiological studies, you can see studies that demonstrate clearly that some people who started off with allergies don't have allergies anymore. Certainly, as a result of confirming allergy with diagnostic testing, the immune system can shift gears, and you can acquire new allergies and you can lose the allergies that you have. But in terms of growing out of it, it's not really related to the age of the individual. It's related to how the immune system behaves. So that most people who develop environmental allergy or food allergy are children, and they're relatively young children. And that's because they inherited the proper genotype from their parents. So they hit the allergy genetic lottery. So that's getting back to the gene by environmental situation. You have to have the proper genes in order to express allergy, coupled with the environmental exposure. If you don't have the correct genotype for expression of allergy, as far as allergy is concerned, not pollutants, but allergy, you will not experience an allergic day in your life unless there's a shifting of gears within your genetic system. And that's why adult onset allergy is relatively rare, even though it can occur. Adult onset asthma is relatively rare, even though it does occur. So allergy and asthma are sort of mixed bags. In the case of allergy, it's very straightforward because your immune system is every millisecond making a decision whether to accept or reject something. And if it is hyperstimulated, it rejects it. In the case of asthma, it's a different ballgame because remember, what we're calling asthma is more than one disease. There have been studies that have demonstrated by all overt manifestations clinically that people have grown out of their asthma chronologically just because asthma doesn't exist anymore using standard measures such as lung function, absence of symptoms, no medicine required, patient has perfectly normal breathing. However, if you subject these patients who had asthma during childhood, who are no longer asthmatics during adulthood, and you do a transbronchial biopsy on these individuals and actually biopsy certain areas within the airways in both lungs, you will find that the inflammatory process that's classic for asthma still exists within their lungs. But for reasons we don't understand, the lungs are not responding in the same way they responded. But the biomarkers reflecting the process called asthma has never disappeared in the airways. And so those individuals have asthma, which has gone into clinical remission, meaning that they used to require asthma medicines, but now they don't because they're symptom free. It means that their lung function is perfectly normal in comparison to an individual without asthma for their age. But they had asthma and it's not clinically expressing itself. But if you do a biopsy on their lungs, you'll find inflammatory tissue consistent with the diagnosis of asthma. And so that remains a little bit of a mystery.
Okay, cool. That's a good nuanced response, and clearly very helpful for those who have asked, because I hear that question all the time, and I think as a primary care doc, good to have an answer that they can kind of walk away from. So I know we're you know, hopefully going to do better with this COVID-19 pandemic. And I'm just curious, from your perspective, have there been any things that you would have done different as it relates to how we've dealt with the pandemic, just from your perspective? Could we have done better? And if we could have, what things would you have done better?
Well, one of the problems is that COVID-19 is a pandemic, and so therefore one's individual actions are not solely responsible for an outcome. Uh, if we had learned earlier about the situation in China, perhaps we could have made earlier moves in terms of travel restrictions and in terms of quarantine. Uh, and that's something that um, is consistent with the old saying, hindsight is 2020. But we really had no control over what information was being released by the Chinese government. And as recently as this week, the World Health Organization is asking the Chinese government to revisit the situation in the Wuhan laboratory. Uh, Not that they're saying that it came from the laboratory, but they're saying that we don't have enough evidence one way or the other to make a determination. So therefore, we need to have permission to revisit this. So that's going to be in the news for time to come. Um, we can't be critical of the speed with which a vaccine was made available because all-time records were broken. The messenger RNA technology platform had already been pre-established, which made it easier to actually develop the messenger RNA vaccine. And the viral vector vaccine, which is the third type of vaccine, or the third vaccine of the three different types. Two are mRNA vaccines, one is viral vector vaccine. Uh, that's old technology, which has been around for many decades. And so it takes usually 5 to 9 years for a vaccine to be FDA approved from the time that it's actually petitioned by, as a result of the time that is required for the FDA after petitioning to approve it. From the very time the original research is done to the time the FDA gives its blessing is 5 to 9 years for the average vaccine. This vaccine doesn't have FDA approval, but it has emergency use authorization, which allowed the fast tracking so that in 9 months we have the vaccine on the market available to individuals who are so inclined to receive it. And that has contributed to development along with people who've been naturally infected with herd immunity, which is increasing. Herd immunity as a target has a shifting definition based upon which scientists you talk to. But the bottom line is that if enough people have antibodies directed against the offending virus, then it's much more difficult for the virus to find a host. And therefore, as it mutates, even if it's more highly infectious, it usually is not more lethal because as it mutates, it loses its lethality in some cases. So I can't say really that on the American side, a lot was done wrong. Um, you have the Swedish situation where there's a difference in philosophy on the part of the epidemiologists. In Sweden, they didn't close down anything, they didn't wear any mask. And their theory was we're going to let herd immunity be achieved ASAP. No mask, no close down of businesses or schools. And we're going to pretend this virus doesn't exist in terms of any corrective action to decrease exposure. And it seems to work for them because their numbers look pretty good. And um, the vaccines, I understand, are not really being used in a large number of individuals over there. So there's more than one way to do things. Now, that's a much smaller country than the United States. And so you can't necessarily look at their situation and say it was applicable to our situation. But I think overall, considering what we've been through, we've done a pretty decent job.
Right. Yeah. Well, I agree. I definitely like the numbers I see when they compare vaccinated folk to unvaccinated. At the time of our podcast, I know we've heard, 99.5% of the deaths have been in unvaccinated people. So, I mean, you can't argue with the numbers. So it is good to know that the technology can serve us, whether people choose to use it or not. So that's just an
And,
interesting question I just had to ask you.
yeah, and there will be additional mutations. There are now over 4,000 COVID-19 variants.
Mm,
We just hear about the ones that are problematic.
right. Yeah,
And
that's
so
interesting.
Delta is the one that's making the news now. Lambda has surfaced, and there'll be more to come. And we anticipate that people are going to get their annual COVID booster just like they get their annual influenza
Hmm.
vaccine.
Yeah, and I
That's
and
what,
I I think it's cool. I think people who choose to get it, it's nice to know that they're going to be working on it. And again, I understand why people hesitate. That is definitely a personal decision. And I'm thinking about your career. It's been a distinguished career. We've worked side by side for several years now, and um, but I'm curious, as you are kind of thinking about the future, do you have any area that you want to focus on the horizon for yourself?
well, I do. I own an environmental control company. I co-own it with a couple of colleagues that actually deals with indoor air quality control. We have equipment at Cook County Prison. We have equipment at Kane County Prison. We have equipment at Kane County Medical Examiner's Office and at one of the fast food restaurants here in the Chicago land area. And we're looking to increase the awareness of the public about the importance of indoor air quality, which includes indoor air pollution, but there are also irritants that are not toxins, which can cause noxious adverse effects upon prolonged exposure. So, and we like to tell people to ventilate. I see patient after patient who says, "Well, doctor, I was cleaning the bathroom, and this bathroom doesn't have any windows, and I was using ammonia, and I added some bleach, and no ventilation whatsoever, and they have chest congestion, chest tightness, coughing spells, and this can go on for weeks because you don't know what degree of damage is going to be induced, even with transient exposure for 20 minutes, let alone protracted exposure." Or oven cleaners being used. "Well, I have to clean my oven, doc. What do you want me to do?" Well, try to use something that's not harsh, and try to have all the windows open, and of course, buy an air purifier or an air cleaning machine to try to help you out there. So, I mean, if you look at the collective hits that the body gets from these chemicals, which are toxic, um, that's one of the reasons that the ultimate endpoint is cancer
Mm,
or autoimmune disease, because the immune system can get confused when certain immune tissue is altered. And now the immune system can begin to attack itself. And that's why it's called autoimmune disease, because the immune system is getting mixed signals, and now it thinks that normal host tissue is a foreign invader, and now that organ system develops severe inflammation and destruction, which is the entire basis of autoimmune disease. And some of this is directly tied to the epigenetic exposures that we mentioned earlier. So
and
that's what I'm doing, and
that's your
I'm
yeah.
working on a couple of books. Uh, I think yours will be out before mine. So
Okay. That's all good. I'm definitely a fan of people like yourself, myself, and putting it on paper. So for those who didn't hear it through a podcast or in the clinic or elsewhere, they'll have a way to get to some valuable information. I think we are to, leave the world better than we found it. I think that was something that Charles Mattox, who I had on a previous episode. He's Bob Marley's nephew, and he talked about his documentary Reversed, helping people to reverse diabetes with diet and also reverse how they think about disease. But he talked about let's leave the world, better than we found it. So another thing I want to ask you about as we get close to the end here, I noticed that you were on a board or sitting on a board or two, and I wanted to understand that's part of what you're doing clearly. What's your role with a board, and how much value can you add by serving on boards?
Well, for people of color, I think it's extremely important to try to be at the table of important boards because that's where decisions are made, which can impact the lives of millions of people. And so I'll just give you an example. The American College of Allergy, Asthma, and Immunology, which I served as president for, has a board of directors. I was the first African American to be on that board, the first person to serve as vice president, first person to serve as treasurer, first black person, that is, to serve as president. So it wasn't that they went out of their way not to have a black person on the board. It's just that there are not a whole lot of black allergists, and many of them are busy making a living in practice and don't have time to attend a bunch of meetings and participate in conference calls. But I felt it was important for me to do so because health policy is in part being determined by who's at the table. And I'll give you an example. You're very well familiar with what we call the National Institutes of Health guidelines for different disease states. Well, I was one of the board members for the NHLBI asthma guidelines, which is the group that writes these guidelines. And I'm sitting around the table with some very distinguished professors from all over the country. There's about a total of 10 of us in the room, as well as a couple of NIH officials. And we're talking about how we're going to put this 700-page document together, which describes and explains to all of the healthcare providers in America, and in many cases outside of America, how to manage asthma with state-of-the-art knowledge. And I said, well, we need to have a chapter or at least a section on racial disparities in asthma. And so the room became silent because I was the only black person in the room. And so, well, you think we need that, Foggs? I said, well, yes. I mean, you all know the statistics as well as I do. A black child is 3 to 4 times more likely to die from asthma than a white child. A Puerto Rican child has 20% prevalence of asthma. African American children around 12 to 15%. Caucasian children 8 to 9%. So we have a greater morbidity, greater mortality from asthma, and this is something that's clearly documentable looking at demographic statistics from the National Institutes of Health, from the Department of Health and Human Services, et cetera. And so I said, that's the justification. And then the room became silent again. And they said, well, Dr. Foggs, would you write that section? Because if I hadn't mentioned it, there would be no section. And so that's an example of being at the table and making a difference as to what's taught and making a difference as to what's recommended as policy for treatment of disease and increasing one's awareness of certain diseases that have an ethnic discrepancy in part contributed to the social determinants that you mentioned.
That's very insightful, and I guess as you have served as a mentor in many ways, that'll inspire me one day to sit on a board and lend my voice as well. I think that makes good sense. I hope anybody listening who has a young person in their lives or a person who's even a professional, let's encourage them, because I bet you if the stats were given, I've heard stats about the lack of color on boards, and it's frightening what I've heard. Very small percentages, and again, if we're gonna, and really diversity is not about just having somebody of color, black, white, Latin American, etc. It's really about making a statement like you've made, and then making sure that the needs of certain communities are being met. And if that voice is not there, it's kind of out of sight, out of mind. So I really appreciate that.
Yeah, one other quick thing is that in academic medicine, we need more of our people. The very fact that I had Two black professors at Harvard Medical School made a tremendous difference. That's all we had.
Mm.
But those two
Mm.
made a tremendous difference because when I would see them walking down the hall doing rounds or seeing them giving lectures, that gave me motivation to carry on. And so role models are critically important at all levels. And so we need more of our people entering academic medicine. And there's been a barrier to academic medicine being entered by our people for a number of reasons. Number one, in the early stages of one's career, it doesn't pay as much. And so for that reason, many African Americans and other minorities have been reluctant to enter academic medicine because uh, it's a different type of hard work. We're all used to long hours in the office and seeing patients, but you have to do some research and you're sort of by yourself sometimes in a silo. And it's not the most friendly environment, especially in circumstances where you're the only color of person around. Uh, every now and then you get fortunate and there may be one or two others, but they may be in a different division and you see them maybe once a week. So that's one of the things that we are trying to do in medicine at large, whether it's family medicine, whether it's internal medicine, et cetera, pediatrics, as well as some of the subspecialties. We need people in every division of medicine because as a result of our increased experience in every endeavor of medicine and our serving as a role model, we can encourage generations to come.
Thank you for that. And you're doing that just by being a voice, by being on this podcast, and just being somebody that our patients can see and look at and admire and respect. So thank you for doing that. And that's why we have to protect you, and we want to make sure you protect your nest. And so as we kind of wrap up, I want to allow you to kind of comment on, what are you going to work on over the next 12 months? And rather it's the nest, which is nutrition, exercise, less stress, more sleep. Um, and obviously thinking positively, avoiding trauma. And then the rope, which is making sure your relationships are healthy, avoiding organisms that can harm you, avoiding pollutants like we talked about today, and making sure E for protecting your emotions and making sure your life experiences that serve you are the ones you kind of keep present and removing those that don't. So when you think about that nest and rope acronym, are there particular areas you really want to give additional attention over the next 12 months?
Yes, one way that I'm providing additional attention is working with some of the organizations that represent largely African American healthcare providers, such as the National Medical Association. And we're starting this program where we can impact high school students as well as medical students to get them interested in the biomedical sciences in general. And if they want to segue into special interest in allergy immunology, that's wonderful too. And as I mentioned, I'm also starting a book which actually addresses a lot of these problems, ranging from air pollutants to a variety of disease states that are linked to exposure to air pollutants or aggravated by exposure to air pollutants. And also dealing with something that constitutes one of the main reasons for patients visiting a healthcare professional, and that's chronic nasal sinus dysfunction. A lot of patients don't know that they have it, but they cough all the time. They snore when they're asleep. They breathe with their mouth open when they're asleep. Some of them have obstructive sleep apnea on top of that, where they stop breathing transiently while they're asleep. And they're just walking around in a funk because their cognitive function is impaired by unchecked nasal sinus dysfunction because they don't know they have it. Sometimes when it escalates to the point where they can actually notice the symptoms and feel like they have rocks in their nostrils 24/7, intermittent sinus pressure, vertigo, popping of the ears, clearing of the throat constantly, recurrent acute bronchitis, and other respiratory tract infections. And they want to know what's wrong with me. And then they get screened for allergy, and the allergy tests sometimes are negative, sometimes they're positive. But what they don't know is that they're suffering from a functional disorder involving the respiratory tract. So just like we have irritable bowel syndrome, where it's not what you eat that's the problem, but it's the state of the gut at the time that you eat what you eat. That's a dysfunction intrinsically to the nerves that innervate the gut. Likewise, there is a disease state, which is really a form of dysfunction because it doesn't progressively result in tissue deterioration as we think of in traditional diseases. but there's ongoing dysfunction of the nasal sinus passages, and that dysfunction is responsible for tremendous misery, and people just live with it. And so, in the book that I'm writing, I'm going to try to develop increased awareness of this problem in conjunction with also air pollution, indoor pollution in particular, as well as allergens, but also teach people how to manage these problems because they can be managed, but before management can take place, you have to have an accurate diagnosis. And believe it or not, nasal dysfunction of the sinus passages and of the nasal passages is actually greater in prevalence in the population at large than allergy. It's just that by default, patients who experience the non allergic dysfunction of the nasal passages and sinus passages are going to think it's either allergy or a common cold. You don't keep a
Right.
common cold for 3 months. And in Chicago, unless you have pets in the house and a lot of dust mites, you're not going to have allergy in the middle of January.
Right.
It's too cold. No
That's
pollens
right.
around. The mold is frozen.
Wow.
So that's what I'm working on. And maybe I'll be on, once I finish, maybe I'll be on your show again.
That's right. Well, that's I think we're all looking forward to that, and it looks like you're covering some of the acronym with how the life experience of the future will be impacted because they'll have access to experts like yourself. So I really appreciate any work you're doing in that space. Obviously, pollutants being addressed, nasal dysfunction being addressed, and you diving into the world of being an author. I think the world will welcome you, and I think your background will allow you to write in a way that will be very insightful and broad, yet not forgetting social determinants of health as you express your thoughts. So we'll wrap up with that, and if you have any final thoughts, or even if anybody's interested in learning more about you in the future, any way for them to find you. I don't know if you're doing any social media like my crazy self.
Yeah. I'm on I'm on LinkedIn. So that's about the extent of my social
That's right. That's right. And that's probably not
media.
a bad idea.
And I would like to say I want to take my hat off to you for leading the way. Uh, you're a person with 1,000 talents and also 1,000 responsibilities, and for you to take time out of your own personal schedule to try to disseminate useful information to the public at large on health and help them with their diets, help them with nutrition, as well as give them the big picture about healthcare at large, I think is tremendously important. And my hat's off to you for sacrificing your time and energy to do so.
Yeah, thank you. And I really appreciate that. And I think we all find ways to kind of give back. And for me, once I found the healing possibilities with this approach, I just couldn't help but to help spread the message. And I, again, inspired by guys like you who are really, and gals who are doing this great work at leading us forward. So thank you. And hopefully, the generation behind me will be inspired as well. So again, thank you for being here today, and I really appreciate you. I think after we finish this podcast, I'm gonna go sit on my deck and get some vitamin D, inspired by you. And it's about this recording's almost 7 p.m. Chicago time, so I got about a good hour to slide it in. I can still see it shining through my window. So thanks again for being with me,
Well,
Dr.
thanks for
Fox.
inviting me. I appreciate it.
Absolutely. So, thanks again. And I appreciate you. And I thank everybody for being here to enjoy this episode as we learn from an expert in this episode of Protecting Your Nest. And for those who are enjoying this episode, today we got some insights into the P in the rope as we learn about how pollutants can help us protect our nests if we avoid them. And even Dr. Fogg's name has given us a clue because the word fog is defined as a thick cloud of tiny water droplets suspended in the atmosphere at or near the Earth's surface, which obscures or restricts visibility. But instead of obscuring our vision, Dr. Fogg has brought some clarity to the topic of pollutants and in some ways has been a breath of fresh air, providing not only clarity on the topic of environmental pollutants, but hope that we can reduce those pollutants, allowing us to live our very, very best life. So, as you continue to learn of the many ways to improve your health, make sure to share how your life has improved as you've learned from experts like Dr. Fox, maybe even in the show notes. And I feel, a little smarter today, and I hope you do too. So, most importantly, I really feel honored that you are allowing me to walk with you towards your health related goals. So as we move forward in life, we can kind of do this work together. So I really appreciate everybody who listened to or saw this episode. And as I close, I want you to continue to be safe, be well, and continue to protect your nest.